Hello, my name is Dr. Diwan S. Raja. Today I will discuss about the classification of the ribs. Ribs are important bones which form a significant part of the skeleton of the thorax. So we will classify according to its articulation, classification according to articulation, to the vertebra and the sternum. Okay. So the ribs which articulate with the vertebra posteriorly, anteriorly to the sternum are the true ribs. Articulates to the vertebra posteriorly and to the sternum by the costal cartilage so the true ribs articulate to the vertebra posteriorly and to the sternum by the costal cartilages. Okay, these are true ribs. So what are the true ribs? The true ribs are the first, second, third, fourth, fifth, sixth and seventh ribs. So these are the true ribs. So if these are true ribs, who are the false rib? Okay. So first, second, third, fourth, from above downward, first through seventh ribs are the true ribs. So we'll go there. Some of the ribs articulate to the vertebra but does not articulate to the sternum by the costal cartilage. Okay, so those are the false ribs. Articulates to the vertebra posteriorly but do not articulate with the sternum by the costal cartilages. By the costal cartilages directly. So these are the false rib. So what are the false rib? 8th rib, 9th rib, 10th rib, 11th rib and 12th rib. So these are the false rib. They articulate to the vertebra posteriorly but they do not articulate with the sternum by the costal cartilages directly. Okay, we got the one type of classification. There is true rib, false rib. True ribs are also called vertebrosternal ribs. They are also called vertebrochondral vertebrosternal ribs. Okay, we got the two ribs, vertebrosternal ribs. We got that. Now we got one type of classification, two ribs, false rib. We have other classifications according to the articulation to the vertebra and the sternum. Okay, classification according to the articulation. Okay, classification according to the articulation. Okay, so first through seventh rib, first, second, third, fourth, fifth, sixth, seventh ribs. These are sternal. These are vertebrosternal, vertebrosternal. They are also the true ribs also. True ribs. Okay, we got that. Now we'll go to the vertebrochondral ribs. Some ribs are called vertebrochondral ribs. Vertebrochondral rib. These ribs are articulated posteriorly to the vertebra. Anteriorly, they end up in the costal margin. Okay, so they articulate to the vertebra, to the costal margin. Okay, they are vertebrochondral joint. What are those? These are the 8th, 9th and 10th ribs. Okay, we have another type of rib. Those are only present posteriorly, only articulate with the vertebra. Those are the floating ribs. These are the vertebral ribs. Vertebral ribs, also called floating ribs because they float. Floating ribs. They are present posteriorly. They are present posteriorly. Okay, and articulate with the vertebra only. Articulate with the vertebra only. What are those ribs? These ribs are the 11th rib and 12th ribs. Okay, so we got, according to articulation, three type of rib: vertebrosternal rib, vertebrochondral rib, vertebral rib. So we got vertebrosternal, vertebrochondral and vertebral rib. We got the classification according to articulation. Okay, now we go classification according to the features. Okay, classification according So we have, in this classification, we have typical ribs, typical rib has typical features, like they have costal groove, the head articulate with two vertebral body, two vertebra. Okay, the head articulate with the two vertebral body, as well as we have also articulation to the intervertebral disc, and costal groove articulation with that, and they have other features like that of tubercle, articulating surface of the tubercle, okay, angle of the rib. So these are the features of the typical rib. Example are the third, fourth, fifth, sixth, and seventh rib. They have typical feature like that. Typical feature, the articular surface has two, the vertebral end has two articular surfaces. In between we have a ridge. The neck of the rib, we have the tubercle of the rib. If we go there, this is typical. Let me try here. Okay, this is better here. So here we got the typical rib. The vertebral end has two articular surface. One is lower, that articulate with the costal facet of the corresponding vertebra. Upper one articulate with the inferior costal facet of one vertebra above. This articulate with the superior costal facet of the corresponding vertebra. Then we have neck, we have tubercle. Tubercle has the articulating part, non-articulating part. We have the angle of the rib around 5 cm in front of the tubercle. Okay, we have the costal groove here. Costal groove is along the inferior border of the rib. Upper border is rounded and inferior border is sharp, and close to the inferior border we have the costal groove that contains the vein, artery, nerve from above downward. Usually nerve is lower, further lower the costal groove. Okay, we got the typical ribs. Now we'll go to the atypical ribs. Atypical ribs. Atypical rib has some atypical features. Atypical rib has atypical features. Okay, they have atypical features. Like the head of the rib may not have two articulating surface. Head of the rib may not articulate with two vertebral body. Okay, costal groove may be missing. Length may be too short, very thick. Okay, those are atypical. Like that, the first rib, very much short, thick, very curved. We have the second rib. Okay, second rib. Okay, atypical feature. We have the 10th rib here. Okay, atypical feature. Then we have the 11th rib, atypical feature, and the 12th rib. Okay, so we got the atypical rib. They have some special feature and they have atypical feature and special feature. These are the atypical ribs. Example is first, second, 10th, 11th, and 12th rib, Okay, we got the classification. First of all, true ribs, false rib. True ribs are the vertebrosternal ribs. We have, according to the articulation, vertebrochondral rib, vertebral rib. Then we got the classification according to the feature, the typical rib, atypical rib. Typical rib, third, fourth, fifth, sixth, seventh rib. Atypical ribs, first, second, 10th, 11th and 12th rib. Okay, we got the classification. Now we'll add few more things. Those are very important to us, especially for the clinical anatomy. One is we have some accessory ribs. Accessory ribs. Rib or ribs. Okay. Someone may have another pair of rib. We call it cervical rib. Another group of people, rare, both of them are not common. Another is the lumbar rib. Sometimes we may not have 12 pairs of rib. We have 11 pair of rib. The 12th pair may be missing. If we have cervical rib, then we have 13 pairs of ribs. Cervical rib articulates with the seventh cervical vertebra. Its length is variable. Okay, so cervical rib is present in around 0.5 to 1% population. Cervical rib is present around 0.5 to 1% population. Okay. Okay. So its length is variable. Its length is variable means that part of it may be bony, part of it may be fibrous, and that fibrous part may be connected to the sternum. Okay. Maybe partly bony, partly fibrous, and it may be connected to the sternum or to the first rib. Okay. Attach the anterior end may attach to the sternum or on the superior surface of the first rib. Okay, we got the cervical rib present in around 0.5 to 1% population. Okay, what is the clinical importance of cervical rib? It is important to us. Okay, cervical rib may be harmless. It may be asymptomatic. No one may know the person has cervical rib. It may be diagnosed accidentally because it may be asymptomatic, but it may cause compression to the subclavian vessel or to the lower trunk of the brachial plexus lower trunk of the brachial plexus. Okay. Causing thoracic outlet syndrome. Thoracic outlet syndrome. Okay, it may cause thoracic outlet syndrome. Okay, we got on the importance of that. Lumbar rib usually is harmless, but it may be confusion to the surgeon, especially in the surgery to the back, especially around the kidney. Okay, sometimes two kidney and sometimes two ribs. So lumbar rib is usually harmless, but it may cause confusion to the surgeon when they do surgery on the kidney. But we have another point is that two ribs may be fused together and may be associated with hemivertebra. That means one part of the vertebra is not developed. It may be wedge-shaped. That may lead to scoliosis in some individual. Okay, so the two rib may be fused together. Usually posteriorly, anteriorly it looks like a fork, and this may be associated with hemivertebra. So that's all about the classification of the rib and also the clinical importance of the accessory ribs. If you have any question, please feel free to ask me. Please share the information with your friends, and please subscribe my channel, support my channel. Have a nice day. Bye now.